those people are stable. There was a very large increase in testing yesterday, and I'm pleased to be able to report that there was over 4,000 tests done yesterday. But some of that will, of course, be people who have travelled from New South Wales and either are in quarantine, or if they're not in quarantine, still required to do testing on day 1, day 5 and day 12. So we've got particular processes in place for those people. But all South Australians have to be aware, if you have people over from New South Wales, now obviously those that are in quarantine you won't be in contact with, but if you have got family from New South Wales and you're in contact with them, you need to be very mindful of symptoms as well. So we've been very happy to almost say goodbye to the Parafield cluster officially, but every South Australian needs to be thinking about, if you get a sore throat, if you feel a little bit unwell, you need to get tested. So we have got testing stations, and of course there is no way that health goes to sleep over Christmas, and all of our hospitals are obviously working, and we have all of our testing stations operating at Christmas. But please check our website before heading out to get a test, just to make sure that you've got the most up-to-date details. Now, there are things that you need to be thinking about at this time of the year. You need to be thinking about COVID safety, but there's other things you need to be thinking about in terms of Christmas safety. And let's start with the COVID safety. So first up, if you get sick, don't go to the Christmas party. I know that you'll be really disappointed, but if you're feeling sick, the last thing you want to be passing on as a Christmas gift to your family is COVID. So do stay at home and let the family know, and I'm sure there'll be plenty of leftovers for you the next day. And talking about leftovers, one of the other things, this is outside of COVID, but I want to talk to you about leftovers at Christmas time, can be a cause of gastro. So people getting sick because their leftovers have started developing bacteria. And so one of the things we always talk about at Christmas time, because there's often lots of food around, is food safety. And if things have been taken out of the fridge, often you put soft cheeses or dips and such like out on platters. After 2 hours, they need to go back into the fridge, because after that time, bacteria can start to grow and people can start to get sick. So there's a range of tips that we've got around food safety that we'll be putting up on our website. So that's an important thing to mention. And then the last thing, people might know I'm a paediatrician, and many children get lots of exciting toys and gifts at Christmas time, and there's often lots of children running around and the adults are happy and talking to each other. You've got to look out for your kids at Christmas and over the New Year period with their new toys and activities. You just need to be watching those kids all the time. We do often see a spike in injuries in young children after that period of time. So those are a few Christmas tips from me today, and I'm very happy to take some questions.
Especially this time of year is when we all catch up with family and friends, a lot of travel into the state. How concerned are you that this might be the most dangerous time for a re-emergence of the virus?
So I certainly have concerns about New South Wales, and the reason for that is very obvious, but we've worked very quickly, my team in CDCB and along with SAPOL, to prevent people coming into our state who we think are at higher risk of having the virus. There haven't been any other confirmed...
SA Health there, stressing the importance of COVID safety over the Christmas period.